Hi, my name is Courtney Slaybaugh, and I'm a nursing student at the University of Michigan. I completed my clinical this semester at the Veterans Hospital in Ann Arbor. I'm going to present a patient to you now. Patient is a 70-year-old single Caucasian male. He is a veteran and used to work in a hardware shop after he served in the Army. He is currently retired. Patient was admitted to the Veterans Hospital on February 6 for surgery on his right foot. He expects to be out of the hospital and back home a couple days after I perform my assessments on him. There was a cut on the posterior end of the patient's foot as a result of a tripping accident that occurred in late June of this past year. The cut later developed an infection and spread to the bone, which was the reason for the surgery. At this time, the patient feels no pain and can walk without assistance. Patient has had diabetes since 1987, which can be accountable for the patient not being able to feel any pain in his lower extremities. He is able to perform daily living activities just as much as he could before. Non-pharmacological interventions could be to keep the patient off his foot and making sure he's as comfortable as he can be. Vital signs are stable. Blood pressure is 132/90, heart rate is 84 beats per minute, respiration is 14 breaths a minute, and temperature is 38 degrees Celsius taken orally. Past medical history: diabetes, high cholesterol, high blood pressure, depression, asthma, bronchitis, and an iron deficiency. All immunizations are up to date. No known drug allergies. Past surgical history: 1987, patient had operations on both feet, and again in 1999, he was hospitalized for a sore on his left foot. Patient is on numerous medications for bronchitis, Sopian stools, high blood pressure, constipation, depression, high cholesterol, iron deficiency, and a medication called Warfarin, which prevents blood clots. Functional assessment: patient denies alcohol, tobacco, and illicit drug use. Patient used to smoke for less than a year during college, however. Patient states that before his surgery, he would use an exercise bike for a half hour each morning. Patient denies any sleeping disorders or eating difficulties and drinks about a liter of diet pop every day. Psychosocial: patient lives on his own in his apartment in Ohio. He states he does not have too many family or friends who can help him. Only his niece and nephew are still living. Both parents and his sister are deceased. Coping mechanisms include Facebook, Sudoku, and going to church every week. Patient denies any more outside stressors. He's very spiritual and identifies himself as Protestant. Family history: father has history of diabetes and hypertension. Mother has history of arthritis. Sister passed away from cancer around the bile duct. No other family members have autoimmune diseases. Review of systems. General health: patient describes his health as very good, and he states he's very satisfied with how healthy he is. He weighs 205 pounds, and his weight and energy are stable. He denies any fever, chills, or night sweats, and he states that he is not tired. He also has no heat or cold intolerances. Peripheral vascular: it is important to do a peripheral vascular assessment on a patient with diabetes to make sure the blood is flowing to every extremity of the body and the pulses are strong. Patient claims to have no pain in legs, calves, thighs, or hip while walking. There are no signs of edema, coolness, or varicose veins on extremities, but there is excessive hair loss on both legs. Patient states he has no history of blood clots in his legs. Upon examination, patient is in no pain lying on the bed. He seems well nourished and well groomed. All pulses are graded at 2, but the popliteal pulse seemed fairly weak. Capillary refill seemed normal. Cardiovascular: patient has a history of high cholesterol and is taking medication for heart failure and high blood pressure, so I thought it was important to listen to the heart sounds of my patient. Patient denies any chest pain or any arm or jaw numbness. He states he has no history of heart disease or murmurs. There is no change in his exertion, and he claims he does not feel fatigued. patient stated that he could walk a dozen blocks without becoming distressed. He has no difficulty lying flat, and he only needs 2 pillows. After palpating his chest, I did not feel anything abnormal. There were no lifts or thrills or chest tenderness. After listening with both the diaphragm and the bell, I did not hear any abnormal sounds or murmurs. Pertinent system number 1, integumentary. The integumentary system protects the body against injury and invasion of microorganisms, harmful substances, and radiation, and also regulates body temperature. It is important as a nurse to check to see if this patient has any more cuts we should know about because his diabetes causes him to lose feeling in his lower extremities. This is his 3rd hospitalization due to an infection on his foot that started off as just a little cut. Pertinent system number 2, musculoskeletal. Because my patient has recently had surgery, it is imperative we check his range of motion and assess for any pain. This exam is important because the musculoskeletal system provides support for the body, protection of internal organs, mobility to engage in physical activities, production of red blood cells, and as a storage of minerals. It would be important to assess if the patient can freely move joints in his body, especially in his foot and ankle, so he can remain independent and walk without assistance. Because of his age as well, it would make sense to check for any changes in bone, such as collapse of intervertebral discs, decreased stature, and barrel chest. At his age, he is much more likely prone to falls and injuries, so it is important to keep an eye out for that.